Let's see our first patient in accident and emergency.
This is not for the faint-hearted.
Rushed into hospital in Liverpool today is Joe, and he's got a worrying eye injury. It certainly looks sore, but how did it happen?
Joe and his best mate were out in the garden getting ready for some tin can target practice.
Ooh, that looks a bit dangerous.
Joe's mate had the pellet gun and thought he had the safety catch switched on, but he didn't.
That is not good.
Nope, and a plastic pellet hit Joe's eye.
Bad news.
Joe's learned the hard way that pellet guns are dangerous.
What are you going to do when you get home then, Joe?
Throw them in the bin.
Sounds like a good idea to me.
Not worth it, is it? Nope.
But what about his friend?
We've left his poor best friend who shot him in his eye at home, who's just mortified. It's just a BB gun from the pound shop, just a toy that we allowed them in the garden, just shooting cans off the fence, and you think that it's okay, but it's not. He's just a bit scared because he can't see through his eye at the minute, aren't you?
Here's Dr. Henri Soueki, an eye specialist, to find out what's going on.
So what we'll need to do is to check your vision, and then I have to examine you under the microscope just to see the extent of the injury.
First is a basic eyesight test.
Can you see the chart there? Cover your bad eye. Can you read from the top? Can you read the letters?
SZNRNCVKCR.
Joe switches eyes and Dr. Henri tries a different test.
Okay,
so just look at my hand. How many fingers?
2.
Yeah. Now?
Can't see it. Can't see it.
Things don't look good, so Dr. Henri uses a microscope to get a closer look at the damage to the surface of Joe's eye.
I'm glad to say it looks like you've been very lucky, Joseph. The ball bearings actually, it's just sort of hasn't gone all the way into the eye. It's just scratched the surface of the eye. But saying that, your vision will be very hazy because there's quite a bit of blood inside the eye.
Your eye is about 2/3 the size of a ping pong ball. At the front is the cornea, and here the doctor can see where the pellet has scratched the surface. At the back of the eye sits the retina. This is a light-sensitive tissue which enables you to see.
Because of the blood at the front of the eye, it's very hard to see the back.
The blood in the eye is a concern, and it means that Dr. Henri can't see the inside of the eye clearly, so he can't tell at this stage whether Joe has permanent eye damage. The doctors decide to send Joe home, but he has to come back again so his eye can be monitored for possible damage. Before he goes, he gets patched up.
We can get a pirate one for you if you want. No.
Less of the pirate jokes, Dr. Henri.
We'll be back later to see how Joe's eye is doing.
Nothing beats a spot of football in the park. Fresh air, aerobic exercise, and of course, the chance to show off those silky football skills, like the step over. Or the cry-off turn. Or the rainbow flick. But football can also be dangerous. You could turn sharply and twist an ankle.
I don't think so, Chris.
Well, you could injure yourself if someone tackled you.
Very unlikely in my case.
You could break your 5th metatarsal kicking the ball too hard.
My metatarsals are as hard as toughened steel.
All right, well, look, just be careful when we're playing. Now, Xandi, on me head, son!
That manoeuvre's known as the Chris Clonk, but it's also an injury alert.
Wow, Chris is very good at pretending to be knocked out, isn't he? So, what should you do if you think someone is unconscious and breathing? A. Tip their head back, check they are breathing, and roll them onto their side. B. Shout "wakey wakey" really loudly. Or C. Lie down next to them and have a sleep, enjoying the peace and quiet.
The answer is A. Tip their head back, check their breathing, and roll them onto their side.
First thing we want to do is check if he's breathing. We can tilt his head back a little bit so his airway's open, and then have a listen. I can feel his breath on my ear, and I can see his chest moving, so we definitely know he's breathing. So now we need to roll him onto his side, so we get his leg up here, get his arm over here, and then we can pull him this way. And then we can use this hand to support his head. And now if he's sick, it goes on the ground, his tongue is going to fall forward so it won't stop him breathing, and we can go and get help because he's nice and safe. Who wants to have a go?
Remember, never do this on your own unless it is an emergency. It's always best to find an adult.
Check if she's breathing.
Well done, girls.
Yeah, he's breathing. Took her your way.
Next, get them into the recovery position.
And then what's the final thing we've got to do?
Check if she's breathing.
That's good. So you have a good old listen, good old look, and she's still breathing.
So, if someone has been knocked unconscious and they're breathing, tip their head back, roll them onto one side, and find an adult.
Hey, do you want to see my new football trick? It's called the Xand loop lift and dive.
Let me think about that for a second. No! Today's fix is all about blood. Some people are missing proteins in their blood that make it clot, which can make them bleed for longer. If they get a knock, they can bruise easily and can bleed inside joints too, where it can be very painful. Conditions like this, where the blood doesn't clot as easily, are called haemophilia, and with the right medication, they can be treated. Meet brothers Ben, Zach and Jake. They all have haemophilia, which is managed by injections of medicine. They have to come to the hospital every 3 months for a checkup with a team that are experts in haemophilia.
Morning.
What can you tell me about haemophilia?
That if you injure yourself seriously, then it could lead to a big bleed.
And what happens if you get just a normal cut or a scratch?
I just go and clean it and then carry on playing.
And the medicine that you've injected keeps working in your body?
Yeah.
The injected medicine allows Jake's blood to clot properly and heal any cuts or bruises. This is Dr. Granger, and he's giving the boys their checkup today.
Normal knobbly knees, no swelling on there.
So they look like the normal shins of a 10-year-old boy, don't they?
It's what I call healthy, active boy bruises.
Yeah.
If he wasn't on his regular treatment, we would see very large sort of tennis ball size bruises, which would often have sort of hard lumps in them, and it'd be a lot more black and blue.
Now this isn't Jake, and it might look a bit extreme, but even a small bruise can become a very big problem if the blood under the skin isn't stopped by medication. So the routine checkup is over, and it's back to school for the brothers. No pictures! Once you're 11, the clinic teaches you to inject the medicine yourself. Meet Mohammed.
Have you ever had a big cut?
Yeah.
I can see a very slight scar there on your forehead.
There is.
There.
I was playing outside with my cousins, and then I went and fell on these rocks, and then I smashed my head, and when I went inside, I was panicking because I never knew what to do.
So when Mohammed gets big cuts, he needs extra treatment. He needs more of his clotting factor, more of this special protein.
Mohammed is going to show me how he injects his medicine.
I mean, this is like you being your own doctor, nurse, and TV star all at once, isn't it?
Yeah.
All right, doctor, carry on. So now you described this like a plane coming into land.
Yeah.
And it does actually, these needles look a little bit like planes, don't they, with their wings?
Now I have to just take off the elastic, and now let me just flush all this in.
As the medicine goes into the vein, it mixes with the blood to help it clot, which means he'll get a scab if he cuts himself, which is what the doctors want.
So it's amazing watching Mohammed do this because I really want to help. Do you know what I mean, Mohammed? I really want to get involved and be like, no, because this is what I'd normally do. So it's lovely to have a patient just do it to themselves.
We do teach the boys to do their injections when they're 10 and 11, and so that Mohammed can now go off and go on school holidays and have trips out without mum worrying whether or not he's going to have a bleed whilst he's out and about.
Yeah.
For Jake, Zach, Ben and Mohammed, their blood doesn't clot as easily. But the treatment and training they get from the team here helps their bodies fix themselves. I mean, in the case of Mohammed, he's not just getting treatment, he's learning to treat himself. Is Mohammed going to put me out of a job? Jan can take 10 to 15 emergency call-outs in a day, and a new case is just in.
We've had a 999 call to see a 32-year-old man who's got a rash and swelling in his mouth. Now, that sounds to me like an allergic reaction. So I've got my camera in the front, Eric has got his camera, and we're going to be getting you as close to the action as possible.
Only a couple of minutes later, and we arrive at our destination.
Hello, is it Alan? Take a seat. My name's Jan. What's the problem today?
I had like a reaction to something. Yeah, tongue was swelling, my throat feels a bit
tight. Have your mouth wide as you can. Fantastic. So your tongue feels big in your mouth, does it?
Yeah, my ear feels quite tight.
Okay.
I was a bit short of breath, but...
Alan is experiencing something called anaphylactic shock, an extreme allergic reaction. Tigger and Sasha look concerned.
So is there anything that you're aware of that you're allergic to? Nothing that you know of?
Although Alan's being pretty brave, he has a life-threatening condition. His lips, tongue can swell, and that can cause problems with breathing and swallowing. So it's actually really important that Jan's here.
What I'll do is I'm going to give you an injection into your arm in a second with a drug called adrenaline.
Now, you may have heard of adrenaline. It's actually a hormone that your body makes. What it's doing in Alan's case is constricting the blood vessels in his tongue, in his lips, and will actually reduce that swelling. In cases like this, it can be life-saving.
I'm sending Alan in the hospital today just so that I can make sure his tongue doesn't swell again. So the drugs I've given only work for a short time.
How are you feeling, Alan? Do you feel like it's working?
Yeah, I do feel a lot of swelling's going down.
Yeah.
An ambulance has arrived to take Alan into hospital.
You'll be all right walking out, yeah?
Yeah, fine, yeah.
It's potentially a life-threatening problem that he had, and Jan's really fixed him up. You could see how much the swelling in his lips had gone down, and that happens all the way down his throat and into his lungs. So that's really, really good news, and they'll be able to treat him really well in hospital.
Now it's time for us to hit the hospitals to show you what goes on. Today, Xand is on duty in the plaster room.
If you break a bone, you'll come here to get it plastered.
Plastering broken limbs is a technique that's been used for over 200 years, and
This team sees hundreds of patients each week.
so they need to work fast. A plaster cast keeps a broken bone in place so that it can heal in the correct position.
Jack, I'm Dr. Xand. Can you tell me what's happened?
I've broken my thumb, tripped, and it snapped. This bit here.
Right in the joint.
When you get a cast like Jack, first a sock goes on to stop the cast itching. Then a layer of cotton wool padding. And finally a layer of plaster, which sets super quick into a hard shell.
So you're just going to look like, yeah, Jack says yes to this.
Now everyone who gets a cast on obviously has to have it taken off. Like Jordan here.
Jordan, what did you do?
Broke my ankle.
How'd you do that?
I was playing rugby.
Love and kisses. Looks like it might all have been worth it.
To get that cast off requires a saw, but not just any saw. Check this out.
What this saw can do is distinguish between hard and soft things.
Whoa! So it can cut through things like wood or plaster casts, but it won't damage anything soft like your skin.
Let me show you on your hand.
Well, it's amazing. It's just tickles.
That's because it has a special vibrating blade, so when it's used by an expert, it means your cast can be off quickly and without hurting you. Anyway, time to meet our next patient. Hang on, I recognise that person.
What have you done?
I broke my leg. What do you think I did?
Did you come off your swing? Did you come off your trampoline?
Yes. Actually, the reason I'm here is because I'm going to get Xand to race Julie and see who can get the cast off quicker.
On one arm will be specialist orthopaedic practitioner Julie, with 17 years experience. And on the other arm will be Dr. Xand, who's been on the ward for just one day. On your marks, set, go. This ward sees hundreds of patients a week, so the team have to be able to get casts on and off quickly. The question is Xand up to the job? Julie's already on the inside. Come on, Xand, what are you doing? A quick snip with the scissors, and I think we have a winner! Somebody is still going, though.
No!
Am I winning? Let me think about that. No. Oh my goodness, is he ever gonna finish? About time, too.
What was the margin?
Julie, you finished in an impressive 51 seconds. Xand, you took just under 5 minutes. If you worked here, which would be ridiculous, Julie would see 5 times as many people as you.
That just goes to show how skilled experts like Julie are. So if you break a bone, you'll be in safe hands, quite literally.
Cup of tea, Chris?
Oh, I'd love a cup of tea. Is this for me?
Yeah.
I made it specially.
That's delicious. Tea is my absolute favourite thing. Are you having one?
No, all for you.
I'm purposely making Chris drink lots of tea. Shh, don't tell him. You'll find out the reason later.
Now, today in the lab, we're going to be looking at the bit of your body which holds your wee or urine, your bladder. Now, over here, we've got a pig's bladder from the butcher's, but it's almost exactly the same as a human one. Your body needs liquid, and it takes it out of everything you eat and drink, along with lots of nutrients. Drink up, Chris. Don't let your tea go cold. But there's always a bit of waste liquid left over that isn't needed, and that's sent to your bladder as wee.
This is what happens when your bladder is full of wee. It can actually hold up to 1 litre of liquid. That's almost the same as 2 pints of milk.
There we go. If I use the torch, you can see just how full the bladder is. And if you think of how small it was when we started, that's pretty amazing.
In the wall of the bladder, there are lots of fibres, and some of these fibres are muscle fibres.
That's right, you can actually see the muscle fibres all over the wall of the bladder here. And what that means is that the bladder can withstand the force of more and more tea, I mean wee, filling it up.
As your bladder fills, it stretches, and sensors in the muscle wall tell your brain you need to go to the loo.
Right, now, are you sure I can't get you another cup of tea? I've got Earl Grey, lemon, herbal.
Absolutely not. My bladder is sending lots of signals to my brain telling me to go to the toilet, and I do feel like I'm going to burst.
Perfect, that's exactly what I wanted.
Hang on a minute. Have you been giving me all this tea for an experiment?
How can I put this? Yes.
I've been giving Chris lots of tea because I want to use his bladder to show you what happens when we empty it. I'm going to use an ultrasound so that we can see what Chris's bladder looks like now that it's full.
Now, what you're looking at here, these top layers are Chris's tummy muscles, and then below here, this big black blob, that's all of Chris's bladder. It's full of clear liquid, which is urine. Now, the reason Chris needs to go so badly is because the sensors in his bladder wall are detecting all the stretching, and this is known as the micturition reflex, the point at which you really, really have to go.
I think pretty confidently I can say that I'm about to feel the micturition reflex.
All right, go ahead then.
What, here in the lab?
Just this once, on one occasion, you're allowed to pee in the lab, Chris.
I think I'd better, because I don't think I'm going to make it to the toilet.
I'm going to hold the ultrasound scanner against my bladder while I'm weeing so you can see it shrinking as I go to the loo.
OK, Chris, let your micturition reflex go. We can see on the ultrasound that Chris's bladder is shrinking, and that's because the muscle fibres are pressing on the bladder, forcing the wee out.
God, that's great. And you can't see his bladder anymore at all. Completely empty. So how much did you go?
You want to see?
Yeah. Wow. So how much is that?
About 1 litre.
It's quite a lot.
So the amazing thing is that my bladder's gone from being this size to so small that we can hardly see it on the ultrasound.
And it's those muscle fibres in the bladder that force all the urine out. But be warned, if you hold in your wee for too long, the muscles in the bladder can weaken, making it harder for it to empty itself.
So when the call of nature comes, it's absolutely vital that you answer it. You know, Chris, I really feel like a cup of tea. I think it's your turn to make it. Now, don't forget to warm the pot. And what I'd like, I think I'd like Earl Grey, maybe jasmine. I think we've got some of that.
And now to our lab.
Where we do incredible experiments to show you how your body works.
So watch this.
Just don't try anything you see here at home.
Now, this is a real stomach, but it's not my stomach.
Whose stomach is it?
Well, actually, it's a sheep's stomach, but it's very similar to ours. Now, your stomach is an amazing shrinking, stretching, cleaning machine.
That's right. After you've eaten food, it goes down into your stomach, which then mashes it up and cleans it to get rid of any bugs that might be there. Another amazing thing your stomach can do is expand according to the food you've eaten. So if you have a small snack, then it'll stay small. But if you eat a big meal, then it'll get much bigger.
And we're going to show you just how much bigger it can get. First, we're going to make a meal of fish fingers, chips and peas.
Yum!
Now we're going to mix it all up in the liquidizer, just like your teeth mash up food when they chew it. And there we go, a nice big jug of fish finger smoothie.
Now we need to pour the mixture into the hole at the top where the food from your mouth goes down into your stomach. We've closed up the hole at the bottom too. This is where the food would leave your stomach to go into your intestines to be absorbed.
Now when you eat, you often, along with your food, swallow some air, and when your stomach squeezes, that air gets forced back up your food pipe and comes out as a burp.
Sorry, Chris.
When you get wind at the other end, it's because gas has been produced in your large intestine. Don't even think about it, just keep pouring. So that has got much bigger, hasn't it?
Your stomach expands depending on how much you've eaten, but an adult stomach can actually swell up to 10 times its own size.
But that's not all. In your stomach, you've got a very powerful acid. It's so strong it kills bacteria and can even change some of your food to make it more digestible.
You see, when you get hungry and your tummy rumbles, that's your stomach producing the acid in preparation for the incoming food.
In your stomach are parietal cells, and they make the acid.
So we're going to show you right now how the acid works. This is my sick. It's a mixture of food and acid, so I'm going to sieve the food out and we'll just be left with the acid.
You love doing this, don't you?
Yes, I do.
So if I sieve out the chunky bits of food, I'm left with just my stomach acid. Then I'll add some of this acid to milk and watch what happens.
If I stir that, can you see that?
Oh, that's disgusting!
So the milk has gone chunky, and that's because the acid has made the protein in the milk all clump together. It's called curdling. It's what happens in your stomach every time you drink a milkshake.
Oh, I like milkshake.
Your stomach acid does this to milk to stop it flowing through your body too quickly. It needs to absorb all the proteins from those crumbly lumps.
So this acid is clearly very strong stuff. So why doesn't it dissolve our gut?
In your stomach, you've got a layer of thick, protective mucus, but the rest of your gut secrete a chemical called bicarbonate, which neutralizes the acid. So when you're having your tea tonight, just remember how brilliant your stomach is.
Ooh, tea? What are we having for tea?
Son, you're always thinking with your stomach.